Hi, it's Fran from Living Your Greatest Life. Have you thought about the benefits of therapy in your situation? So if you're an alienated parent, being targeted, or even if you've left an abusive relationship, sometimes we struggle to move on. And certainly in the case of parental alienation, you're so powerless that there is very little that you can do. So you are relying on certain systems to protect your children, namely the mental health system, the social services system, children's services, the family court system, the legal system, and very often this doesn't pan out as we wish it to, so then you're left with nothing. You're left with no control and no ability to help your children. So therefore you can only turn the focus onto you. And the reason why I've suggested therapy, having had quite a few lots of that myself, I am not an expert on therapy, I am not a therapist, but I can say that yes, it's worked for me and it's worked for a lot of other people too. It's not a magic solution, but it's certainly something that you could consider in your situation. When it comes to the therapy available to you, there isn't any tried and tested solution to your specific problem. I think, in my opinion, I think maybe the best thing that you can hope for is that you have a really good relationship with the therapist. So, for example, if you get in a room with somebody and you don't resonate with them, or they make you feel awkward, or you just don't hit it off, then that person probably isn't for you. Although saying that can be difficult, so you might need to give it a few sessions. So I don't want to be teaching you how to suck eggs here, but certainly you understand the impact on you emotionally of being targeted, being a targeted parent, being not able to see your children for a specific period of time. It could be a few months, it may be a few years, it could be more. So I don't need to sit here and tell you what those feelings are. But the reason that I'm talking about therapy is because it can help to alleviate some of those, the kind of symptoms that you have to deal with. And of course, our priority is always the children. But you see, the thing is, on your own, against systems that fail the children, you're pretty powerless. So like I said, the only thing you can do is something for you to make yourself stronger and have the ability to deal with it coming from a better, stronger place. And besides from the emotional impact from the alienation, it can also cause massive relationship issues. It could be with your current partner, it could be with family members, because don't forget, when we aren't seeing our children, very often our family members are excluded too, and that can lead to all sorts of arguments and difficulties and friction. So in terms of the symptoms that you may experience, I'm guessing that although there isn't any kind of definitive thing, a lot of people report symptoms of PTSD or complex PTSD in other sort of things associated with trauma. So they're the kind of therapists that you would be looking at specifically. And any good therapist, you should be able to explain your situation, and they may have an understanding, a concept of how to help you. Now, the type of therapy that you choose is going to be dependent on a lot of things, but I think personally, and this is my personal opinion, I really love hypnotherapy because for me at the time, I didn't want to go into any long talking and discussion of my situation. I just needed to deal with some residual stuff in there, because sometimes we do things or we feel a certain way and we're not even conscious of why that is. We haven't explored that yet. So that's a really good one if you're open to that kind of thing. And there's a specific type of hypnotherapy. So for example, if you can see a pattern perhaps in your childhood, or something in your childhood which may have made you gravitate towards a toxic type personality. So that could have been maybe that one of your parents wasn't a good enough parent, then maybe you could look at something like inner child hypnotherapy. I think that's a really good thing. And what that does is to help you to heal from any childhood experiences which could impact your parenting going forward, because we're under the assumption we can't say, you know, you're never going to see your children again, because you very well might, and obviously you need to be the best version of yourself. So that would help you deal with any sort of childhood issues, maybe having emotionally unavailable parents, and that sort of thing. However, if the thought of being hypnotized is not for you, then there's plenty of more stuff out there. Now, one of the really common ones that you are likely to access through maybe like NHS or something like that, if you live in the UK, that is, you know, trauma-related or trauma-based CBT, cognitive behavioural therapy. I can't really sit here and tell you how it works, but we know that it does work. It's an evidence-based practice, and it's probably more readily available. Another really good one is psychotherapy, because it kind of recognises the effects of lasting trauma. They work a lot with anxiety and grief. So I think it's something that's really positive, but always make sure if you're going to use a psychotherapist that they have a regulating body. For example, the British Association of Counsellors and Psychotherapists, or the UK Psychotherapists, something or other. So always find that regulating body for whichever country or area you're in, just to check that these people have, you know, they're regulated, they've got the right credentials. The same with hypnotherapy or any other therapy really, unless of course you're going via the NHS route. The good thing is about psychotherapy that it really helps to kind of fine-tune your relationships with people, and more importantly, and especially in this situation, your relationship with yourself, because that is really what's really important to look at here when you're doing the therapy. And of course there is eye movement, desensitization and reprocessing. That is EMDR, commonly known as. I think in terms of the other therapies, I might be wrong, but I think it's a newer type of therapy. But I've heard some really good results and read some really good stuff about that. Now, I'm no therapist, but I believe that with the EMDR, that you're making eye movements and whilst recalling serious or traumatic events. If you're not too keen on talking, it doesn't rely on talking too much, because I'm sure you've done plenty of that. Although they would take history, that is part of it, but it's not, you know, and how do you feel like that? Why do you feel like it's not kind of like that kind of therapy? It's not intrusive. I personally haven't had that, but I know people that have. And I guess the key thing is that it kind of dampens down your emotionally charged memories. So if you're not getting all anxious every time you think about your situation, and that's not so powerful, you're probably able to function and lead a better quality of life, I'd say. So without further ado, do your research, make sure that anybody that you use, you know, go and look at their regulated bodies, sites, just check them out. I wouldn't even hesitate to do that. It may be something that you've done before, maybe you need to do it again, but it's definitely something that you probably could really use. But if you are struggling financially, I'm sure that you can find a way to do it. So yeah, call it an investment in you, an investment in your future, and an investment in feeling more peaceful than walking around being angry and crying all the time, being anxious and stuff like that. So I really do believe that it can help you. So the question is, who's going to benefit if you have therapy? Well, number one, you will, and in the event of getting to see your children again, they'll definitely benefit. So it's a win-win situation. Thanks for sticking with me. Like I said, I don't claim to know everything about therapy. This is only just stuff that I'm kind of letting you know from my personal opinion. I know it's helped me. I want to help you. Okay, you take care. You've got this 100%. I'll see you in my next video.